So medical and surgical management. So for the medical management, we have chemotherapy, targeted therapy, immunotherapy, radiation therapy, and palliative care. So first is the chemotherapy, which is the using of drugs to kill growing cells, including cancer cells. And then next is the targeted therapy. So this focus on specific abnormalities present within cancer cells. So by blocking these abnormalities, targeted drug treatments can cause cancer cells to die. And then third is the immunotherapy, which uses your immune system to fight cancer. So immunotherapy treatments are generally reserved for people with advanced liver cancer. And then next is the radiation therapy. So this treatment uses high-powered energy such as X-rays and protons to destroy cancer cells and shrink tumors. So doctors carefully direct the energy to the liver while sparing the surrounding healthy tissues. And lastly, the palliative care. So palliative care is a specialized medical care that focuses on providing relief from pain and other symptoms of a serious illness. And then next is for the surgical management. So we have two, the surgical resection and liver transplantation. So surgical resection is the removal of liver tumors if they are localized.
Health Education Plan. Objectives. After 5 minutes of health education, the patient will be able to discuss the importance of following their treatment plan to control both conditions effectively. After 10 minutes of health education, the patient will be able to enhance knowledge of personalized dietary recommendations to manage diabetes while supporting liver health, focusing on low glycemic index food and liver-friendly options to minimize complications and maintain energy levels. After 2 weeks of health education, the patient will improve overall well-being and potentially slow disease progression in both diabetes and liver cancer. We also engage in regular physical activity, gradually increase endurance and strength levels as measured by improvements in exercise tolerance. General health teachings. Consuming a healthy, balanced diet before, during, and after treatment can help the patient feel better, maintain strength, and promote recovery. Specific health teachings. Lean proteins such as chicken, fish, and eggs, low-fat dairy products, nuts, and soy, which can boost the immune system and promote healing. Fruits and vegetables which are rich in antioxidants that can help your body fight cancer. Eat 6 to 8 small meals a day instead of 2 to 3 larger meals. Advice on the importance of balancing rest with gradual increase in physical activity to prevent post-operative complications such as deep vein thrombosis and promote overall recovery and strength, such as walking with assistance and gentle stretching exercises. Emphasize the importance of adhering to prescribed medications, including pain management, antiemetics, and antibiotics, to prevent complications and promote healing post-operatively. Ensure the patient understands the purpose, dosage, and potential side effects of all prescribed medications. Schedule follow-up appointments to assess progress, adjust treatment plans as needed, and address any concerns or questions the patient may have. Emphasize the importance of regular monitoring of blood sugar levels, liver function tests, and other relevant parameters as advised by healthcare providers.
I am Ben Rafael Lope and I'm going to discuss about the discharge plan. So for our first medication, we have Tramadol and its brand name Olchan. So for the dosage, we have 50 milligrams and the frequency is every 6 hours and round the clock. So for the nursing instruction, instruct the patient to take Tramadol exactly as prescribed by the healthcare provider. Instruct the patient to take Tramadol orally with full glass of water, with or without food as directed by the healthcare provider. And educate the patient about the common side effects. So for our second medication, we have Omeprazole and its brand name is Convomep. So for the dosage, we have 40 milligrams and the frequency is every 12 hours. So for the nursing instruction, instruct the patient to take Omeprazole exactly as prescribed by the healthcare provider and advise the patient to swallow Omeprazole capsules whole with a full glass of water. and explain to the patient that omeprazole is typically prescribed for a specific duration for treatment, and advise the patient to avoid certain substances that can worsen stomach acid production. So for our third medication, we have metoclopramide, and its brand name is Reglan. So the dosage is 10 milligrams, and the frequency is every 8 hours. So for the nursing instruction, instruct the patient to take Reglan exactly as prescribed by the healthcare provider. Missing doses or taking extra doses can lead to complications. Advise the patient to take Reglan before meals to enhance effectiveness in promoting gastric emptying. Educate the patient about potential side effects of Reglan, such as drowsiness, dizziness, restlessness, and gastrointestinal disturbances like diarrhea or constipation. So for our last medication, we have ceftriaxone, and its brand name is Rosifin. So for the dosage, we have 12 grams, and the frequency is now. So for the nursing instruction, Rosifin is typically administered intravenously or intramuscularly by a healthcare professional in a clinical setting. So for the exercise, gentle walking can improve cardiovascular health and circulation without putting excessive strain on the body. Gentle stretching exercises can help improve flexibility and reduce muscle tensions. Swimming is a low-impact exercise that can help improve cardiovascular fitness and muscle strength without putting stress on the joints. So for the diet, incorporate healthy fats from sources such as avocados, nuts, seeds, and fatty fish like salmon or mackerel. Choose lean protein sources such as poultry, fish, beans, lentils, tofu, and low-fat dairy products. Aim to include a variety of fruit and vegetable in your diet to provide essential vitamin, minerals, and antioxidant. OPD visit whole grains such as brown rice, whole wheat bread, and oats, which provide fiber and essential nutrients. And for the health teaching, educate individual about what hepatocellular carcinoma is, including the causes, risk factors, symptoms, and stages of progression. Emphasize the importance of consuming variety of fruits, vegetables, lean proteins, healthy fats, and whole grains while limiting processed food, alcohol, and sodium intake. Encourage individuals to engage regular physical activities such as walking and jogging to improve strength, flexibility, and overall health. Offer information about support groups, counseling services, and other resources available to help individuals by their family navigate the challenges of living with hepatocellular carcinoma. So for the OPD visits, OPD visits for surveillance are scheduled at regular intervals, typically every 3 to 6 months, but this can vary based on individual factors and guidelines from the healthcare provider. So for the spiritual care, assess the availability of support system of the client, including the family and friends. Encourage open communication with patterns, family, and healthcare providers about emotional well-being.
The successful liver transplant can cure liver cancer, but not everyone who needs a liver transplant will be healthy enough to go through a transplant or able to find a donor. The studies show people who have surgery to remove part of their liver tend to live longer than people whose illness prevents surgery. So when that happens, healthcare providers focus on treatments to help people with quality of life for as long as possible. So healthcare providers are making progress on liver cancer treatment so people can live longer, but liver cancer remain a life-threatening disease. The data shows that 35% of people treated for early-stage hepatocellular carcinoma or HCC liver are alive 5 years after diagnosis, and about 12% of people treated for HCC that has spread to nearby nearby tissues, organs, or lymph nodes are alive 5 years after diagnosis, and about 3% of people treated for HCC that has spread further are alive 5 years after diagnosis. So the 5-year survival rates for intrahepatic bile or IHC duct cancer are 24% for bile duct that hasn't spread outside of your liver, 9% for cancer that spread to nearby lymph nodes, and 2% for cancer that spreads further.